In this video, I'm going to demonstrate passive stretching on the treatment couch or on the treatment plinth. We're going to do passive and the adaptation of PNF stretching as well. And PNF stands for proprioceptive neuromuscular facilitation, which is an advanced form of deep stretching. The muscles that we're going to stretch today include the gluteus maximus and the deep hip abductor muscles, including the piriformis. So this is a really nice stretching technique, or these are nice stretching techniques, and they can be included within the middle of the treatment, or they can be included at the end of your treatment, whether it's a sports therapy, physiotherapy, or massage-based treatment. Okay, so I've already prepared the towels for the client because we're treating this as though we are in the middle of a massage treatment. We want to make sure that the client's dignity is maintained with the towels. Now it needs to be, so in this instance what I've done is I've taken an extra towel and we've tucked it in between the legs so that we can tuck that towel into the client's underwear or into the client's clothing. So we're still maintaining their dignity. So we know that the gluteus maximus is a strong, powerful muscle that helps to extend the hip. So it takes the hip from a flexed position into an extended position. So in order to stretch the gluteus maximus, we want to bring the knee in towards the chest. We want to make sure that we're using our body effectively as well. So we're not leaning over the client too much and invading their space, but we're still making the client feel secure and we're applying adequate pressure so that the muscle is into a stretched position. So from here, what we're going to do is flex the client's hip and flex the knee. And we're just double checking that the towel is still covering everything here. Then what we're working towards is keeping that hip roughly in line with the shoulder. So we're just being aware if the client's dropping the knee in or dropping the knee out. So we want that nice alignment. And then from here, without applying too much pressure over the spine of tibia here. So I'm gripping with my fingers. I'm not pushing straight down on that shin bone because that can sometimes be a bit uncomfortable. And then I'm using my other hand at the side here in order to bring that knee back towards the client's chest. We're making sure we're asking for feedback to make sure that the client can feel that stretch. And Lydia's got really good flexibility here, but if she wasn't feeling that stretch, then I can use my body weight. So I'm tucking my elbows in here to enable myself to use my body weight to apply extra pressure there without having to lean too far into my client. Okay, so if we were doing a passive stretch here, we'd be holding this stretch with maintaining this one movement for about 15 to 30 seconds, depending on how much treatment time you've got available. Okay, the longer you hold it, possibly you might get more of a release into the muscle. Okay, if we were turning this into a PNF stretch, what we would then do is ask the client to push into my hand on the shin here. So she's going to contract the muscle that we're stretching and effectively try to push away or push me away. I'm using my body position to stop that movement from occurring. So she's producing, or the client is producing, an isometric contraction. So if you push up into my hand, Lydia, I'm just making sure I'm resisting that movement, holding that for about 6 seconds. Now, as she releases after 6 seconds, she's going to let go of that contraction. Be careful of your body position because you don't want to drop down onto the client now. Okay, so then from here, I'm now going to deepen that stretch. Okay, taking that stretch slightly further. Good practice if you can increase the stretch whilst the client is breathing outwards. We're going to hold that stretch again for about 15 seconds, and then we could go into a second round. Okay, so if that's been roughly 15 seconds, what we would do is ask the client to push up into my hands. Okay, good. And then relax after about 6 seconds, making sure again you're holding your body position. And then from here, I'm just going to change my hand position so I can get the client into a deeper stretch. If you were a smaller therapist and you had a large client here, maybe more muscular, you might then want to bring the hand across the couch, take hold of the treatment couch, and then bring that leg into the armpit there. Sometimes, I mean, this is going to help you to hold that position on your larger clients, but you're just being aware that you be aware of how close you are and whether you're invading that personal space. Okay, so that was our passive stretch for the gluteus maximus, and we also changed that into a PNF stretch as well with that contraction. So if we were purely doing that passive stretch, we would take the leg from that lying position, flex at the knee, flex at the hip, and then we're taking the client into that stretched position. Okay, then if we were just doing that stretch, that's fine, that's a passive glute stretch. Or if we were doing the PNF stretch, you don't have to do both together, you could do one or the other. For the PNF stretch, which is the proprioceptive neuromuscular facilitation, which provides a deeper stretch from that isometric contraction, you're going to bring that leg up, hold the initial stretch for about 15 seconds. Then the client is contracting, you're resisting that movement, they're contracting for about 6 seconds. They relax that contraction, and then that enables you to go into a deeper stretch position. Okay, and you could repeat that 2 or 3 rounds, depending on the aim of your treatment. Okay, so that is our gluteus maximus stretch. It's also nice, you could do just your glute max stretch within your treatment, depending on your treatment aims, or you might find that you want to stretch the gluteus maximus and stretch that deep piriformis muscle, especially if your client is suffering from a condition such as piriformis syndrome, where they get that sciatic type symptom going down the back of the leg. Okay, so to stretch the piriformis, what we're going to do, several different ways that we can stretch the piriformis muscle on the couch. But one nice way is, again, coming back to this flexed position. So we've got the knee in line with the hip. Then what we're going to do is we're going to externally rotate at the hip slightly here. So just being mindful again, try not to allow the client to drop the leg out to the side. So we've got the knee in line with the hip, we're externally rotating here. And then from there, remember, we're not gripping too much around the ankle here. So I'm just supporting just above the ankle joint. And then I'm going to be applying my pressure just to the outer side of the knee there. And I'm bringing this knee over towards the client's opposite shoulder. Can you feel that stretch, Lydia? Excellent. So I can feel a little bit of biting here. The client can feel the stretch. So if we were doing a passive stretch, we would hold this stretch for 15 to 30 seconds and then release the position. If we wanted to turn this into a PNF stretch, a simple way that we could do that would be to ask the client to push their knee back into my hand. Again, you're going to resist that movement, so make sure you've got a stable base in your body to resist that movement. Okay, for about 6 seconds, then she's going to relax, and then from here, taking that knee slightly further over. And we want to make sure that the client is feeling the stretch around that piriformis or deep gluteal area. And then again, from here, the client's going to lift up, you're resisting, trying to make sure there's no movement so that they're just matching your pressure, and then release, and then take that into a slightly deeper stretch. How's that feeling? Excellent. And then after 2 or 3 rounds, we would then lower that leg back down towards the couch. Okay, so passive and PNF stretching for gluteus maximus and the deep piriformis muscle that could be included in the middle of your sports therapy or massage therapy treatment or at the end of the treatment.